Welcome and good morning to the webinar, The European Health Workforce and the Digital Skill Gap. What is the EU's role in closing the divide? We all know how important digital tools are for health and health systems. We can hardly conceive care integration without digital. So how do we connect the different services, the different processes, and in particular, the people, the health workers, the informal carers, and the patients? There is no proper primary care without some basic digital tools. And think about the interface between hospitals and primary care. Do you still want to wait for a letter of discharge? We also need to reach out to the social care sector. Again, the best way to do it is with digital tools. And very often, in many European countries, digital tools are actually available, but they are not taken up to the extent we would like to see it, because there are large skills gaps in the health workforce. Very often within countries, between regions, some regions have embraced digital tools and have trained the health workforce to use them, while others are lagging behind, sometimes between urban areas and rural areas. But in particular, there are gaps between professions. Some professions are well trained, while others still don't have it in their curricula. There are reasons for this, which we need to discuss. And of course, there are skill gaps between countries. Some countries have made more progress skilling the health workforce, while others are lagging behind. So what exactly is the skill gaps and how can we close it? And on top of it, what is the EU's role helping member states closing it? This is the second installment of a series of webinars of the European Health Union Initiative. We are asking for a true European Health Union, which is not just crisis preparedness and responsiveness, but helping countries build back better, making better health systems more efficient, better accessible, and better quality. The EU Health Initiative is a conglomerate of a couple of people and institutions supporting this. And today's webinar is co-organized between the European Health Forum, Gastein, and the Observatory. This is for me the moment to thank and welcome Dolika Gottlieb, the Secretary General of European Health Forum Gastein. She will monitor the chat and give some feedback from the audience. Today, we have really a fantastic panel. We have Isabelle Sablit from the French Ministry of Health. She's in charge of eHealth Europe and is there the international director. We have Bernadette Klapper from Germany. She's the CEO of the German Nurse Association. We have Niklas Eckler, Head of Unit for eHealth and Structured Information from Sweden. It's the National Board of Health and Welfare. And last but not least, we are most grateful that Dirk van Steen has joined the panel. He's the Deputy Head of Unit Performance of National Health Systems in DG Santé. But before we turn to the panelists, I have the great pleasure to start today's conversation with Sarah Cerdas, member of the European Parliament. Sarah, good morning, and thank you for making yourself available. I know you're a little bit pressed time-wise because you're sitting in the airport waiting for your flight. But let me allow to jump right into the first question. Sarah, you have first-hand experience. You're a medical doctor. You're from Portugal, and you know the Portugal system inside out and the people working there. Have you experienced some sort of skill gap in the Portuguese health workforce? Digital skill gap.
Yes. Good morning, Matthias. Good morning, everyone. Such a pleasure to be here. I would like to thank the European Observatory in Health Systems and Policies and the European Health Forum of Gastein for organizing such important webinar in an up-and-coming topic that we will have, and I'll disclose that later on in my intervention. So as I'm a medical doctor since 2013. And I have worked at different levels within the national healthcare system. I have also lived through the paper to electronic transition, and this in the Portuguese national healthcare system. Sorry, and this has led to a great impact in the daily work. And this had, when we moved to more electronic records, this allowed us to have more reliable data, easier access to patients' medical history, also easier access to exams, and close the gap between the information that comes from the primary to the secondary services, from the primary care to the hospital care. However, since I've started as a medical doctor, as a junior doctor, I have never had a proper, even a class, even a 1-hour training on how to use all these different systems that I was engulfing in. And this is very important, the lack of training. So there was already a lack of training to those entering in the workforce. And speaking from my own experience, of course, as you might know, I'm a millennial, so I'm 32. I have lived through the digitalization, not only in healthcare, but there was a significant skill gap among my colleagues, my eldest colleagues. And this truly hindered their work and what they could contribute to their patients. And it led to more burden in their workday. And this led also, of course, us junior doctors that could have a bit more skills in the digital world would help them. So here just to say that there was no opportunity whatsoever for upskilling when these new digital tools were implemented. However, many changes have happened since, and I'm in the European Parliament now for 2.5 years, but I would like to highlight several apps that now exist where patients can actually have access to their data, to the medical prescriptions, exams prescriptions, everything in one place, knowing what are the waiting times to go to if they have an urgency and they don't know if they should go to hospital A or B. Because of the times of waiting times, they can access the waiting times. So this is very important. There's a lot to be improved, but there's also a lot that has been done in the last 10 years in Portugal. What needs to be done in Portugal? Better training for healthcare workforce. It needs to be more digitally centered. And also the access to multi-centric data for research purposes is lacking, and some data from public services is not connected. So here we're lacking interoperability. So this is my take-home messages on what we can improve in Portugal.
That's great. May I ask you back, because I think very beautiful, you have addressed a little bit of a generational divide, that the younger generation of doctors has adopted these skills, but the older, there's a question of continuous medical development and continuous professional development probably. But you also have addressed health literacy, actually, that the patients are taking charge of their data and their appointments via digital tools as well. And I just wanted to ask you, I mean, you work a lot with other professions in the system in Portugal. Have they all been trained on digital tools? Are they using it, or is there also a bit of a divide between the different professions in your country?
There's still a great divide, even though there has been a lot of effort in Portugal, at least in the reality of the last 6 years, to improve this accessibility and interoperability within systems. But still there's some lagging there, lacking. But we hope in the near future this interoperability can be more oiled in a sense. Also, there's the fact that we have a national healthcare system, but we have 2 autonomous regions that their healthcare is regionalized, and sometimes the systems don't communicate that well with each other. And I come from one of those regions. I come from Madeira, and sometimes my information as a patient in Madeira doesn't communicate with the information of a patient as a patient if I for instance go to a medical doctor in Lisbon. So sometimes there's a lack of communication. And also one of the points I would like to highlight is sometimes there's a lot of digital stress in the healthcare workforce, because even medical professions, but also nurses, these are the professions I mostly contact with, we use a lot of different systems for the same patient, sometimes 5 to 7 different programs. So
fantastic. Sarah, I would have so many questions. I could listen to you all the time, but being mindful of the time and your departure time, can we go to the second question? And we would now like to turn to your current profession as a member of the European Parliament and talking about important legislative initiatives that are happening in the Parliament. But maybe you can also give us a little bit of an impression of what the discussion is in the Parliament, in the committees.
Yeah, thank you, Matthias. Yes, it's such a pleasure to be talking on this topic. But now I'll put the other hat as a member of the European Parliament. Just to tell you that I just received notice that my flight is delayed for 15 minutes, so I'm not that stressed with boarding time anymore. But I'll try to be brief for the sake of the discussion for the next panel. So there's, I think we need to look for health in the European Union with what has happened with the COVID-19 pandemic, which was the biggest event and truly highlighted the importance that health has in our society. There's some very good lessons that we need to understand is that the importance of the health workforce in the different health systems, and also the importance of the digital tools in that, how they helped us improving our response capacity in the biggest pandemic we've seen in the last 100 years. And many tools prevailed during the pandemic, telemedicine in eHealth. So moving on from what we learned in the pandemic, there's two biggest initiatives by the European Union that have been launched and negotiated. One is already in the field, and the other one hopefully we're finishing negotiations in the coming days. So I'll tell you about this. This is the EU for Health program, which is the health program for the European Union for the next 7 years until 2027. And the other one is the European Health Union legislative package. So, and this is the one that we hope to finish negotiations in the coming days. I was negotiator in the EU for health, and I am negotiator in the how to improve the EU for serious cross-border health threats. So we want to be better prepared and for the future health crisis. And what are we doing in regards to digitalization in these two biggest packages? We know that up and coming, the European Commission will launch its proposal for the European health data space. And this is something that has been linked to all of these proposals and also with the Beating Cancer Plan. What is the main aim of the European health data space is to promote the exchange of patients' data, safe exchange, including when they travel abroad, and also allows for citizens control over their health data. So this will allow us to build an eHealth digital service infrastructure. This will lead to better support research for treatments, medicines, medical devices, and outcomes. This will also encourage the accessibility and usage of health data for research, policymaking, and regulation. And of course, this needs to be accompanied by a trusted governance framework and upholding the GDPR and also all other data protection rules that we have. And the last two biggest goals is the support to digital health services and clarify what are the opportunities and liabilities of artificial intelligence in health. Yeah. So this is a very important topic that we are discussing in different committees here in the European Parliament.
Sarah, apparently there's a huge legislative agenda, and we know that some of these proposals not only quite complex but also very comprehensive. But the question is, today we are focusing a little bit on the health workforce, and we were wondering, how can actually these legislative proposals not only provide the space for digital solution and the implementation of digital tools, but also help the health workforce, help people being trained and adopted?
Yeah, this is, as a medical doctor and working now in health policy at the European Parliament, this is one of the biggest focus of mine in our work, of mine and my team. So with this further digitalization expected and upcoming in the healthcare sector, we must require require that health professionals do have the opportunity to upgrade their competences and skills in order to be better prepared on all these different digital tools that are aimed to simplify and ease their work, so they can focus and reduce the bureaucratic burden of the healthcare workforce at the moment and focus on their patients as they have. So for this, there's a huge need for upskilling workers and improve the digital health curricula, the training, the lifelong training, and also something very important to us in the European Union, with 27 countries, is the exchanges of relevant good practices. For instance, what's going on now in Portugal, where I can access all my health information, perhaps is something that can be applied, for instance, in Sweden, and the exchange of this information and good practices can really boost and be more efficient on what we want to achieve. Sarah. This is very important, and capacity building networks is something that we want also to create. So in order that in order to ensure that there are the instruments in place to guarantee proper training and upskilling for the healthcare workforce, and not forget that there's gaps, generational gaps. So it should be directed training.
Yes, Sarah, I think this is music to the ears of many of our panelists, and I'm sure they will pick up some of what you have said. I would like to invite you to stay on with the panelists as long as you wish, but I understand that you are a little bit in a rush now. I would now like to turn to our panelists, and we want to have this discussion. Pleasure. And we would like to have this discussion in 3 rounds. The first round is a little bit of a state of play. The second round is on digital Europe, and the third one will be on the concrete strategies to help upskill and rightly skill the health workforce and close the digital divide. And I would like now to ask, first of all, Bernadette from the German Nursing Association about her experiences with the stuff in COVID-19, because we've all seen that COVID-19 and responses to COVID-19 have laid bare many deficiencies of health systems. And I guess, Bernadette, you've also seen some deficiencies in terms of digital skills and digital participation, actually. Could you fill us in a little bit on the German situation? And please, everybody forgive me if I give you signs to be short, but we have a very full panel today. Bernadette, please.
Yes, thank you very much, Matthias, and hello from Berlin. Thank you very much for inviting me. Yes, I think the question is important, and I think basically what we learned in the pandemics is how important data is in every sense. I mean, and I think in healthcare, it really starts with the individual person and the data around it, so to say, the electronic health record, which is a little bit missing behind, particularly in Germany. And I think Sarah, she did an excellent start on it. She pointed out that it would be so helpful to cross-border the information around it. So from a technical side, you just need standardization and classification from the technical language behind, so it works in every country. But for the user side, it would make sense absolutely that everybody around a single person has access to the information, to the record. Of course, after the acknowledgement of the person itself, data protection is of course core, no doubt about this one. But it would extremely help if everybody is involved, and this is the turning point in it. And that's would be my first statement here.
Thank you so much, Bernadette. And coming back to COVID-19, were there particular issues or situation where you would have said, oh, I wish that the nurses would have been trained for digital tools and would have had these digital tools?
I think there was a lot of doubts about how it works with the Corona app, which we have, but it was not really. It was on the person side, it was not only on the care side. So a nurse in Germany did not have a really other situation than a normal citizen would have. And this is a little bit of a point that we have been missing so far. So there was not an add-on for the workforce in this sense.
Yeah, so you were disconnected in principle, and there was no skilling on this side. Thank you so much, Bernadette. We will get back to you later on. Isabel, please tell us a little bit from French, from the ministry's perspective.
Yeah, thank you, Matthias. Well, in case, if I come back to the COVID-19 crisis, in fact, so many times we heard, what if we had more digital health in place? What if we had better health data for policy making, research, innovation, and so on? So there was a wide recognition of the what if, I would say, and that has helped us a lot afterwards to put the right plans in place. At the same time, also there was this assessment that there is a so to say, a vicious circle that due to the lack of digital health skills, we can't move forward to implement digital health in the best way. So, you know, these were some of the key lessons learned. At the same time, the COVID-19 crisis has helped us a lot in the way digital health professionals have grasped, I would say, digital health tools already, both in their private life with the EU COVID digital certificate, of course, like everyone, but also in terms of the use of telehealth services, for instance, which has exploded. And if we cannot limit digital health to telehealth, it has been a strong example of the potential of digital health as such. So we have been multiplying by so much the use of telehealth. It has been incredible. And it has been a strong recognition from the health professionals' point of view that it was not nice to have, but a real tool to use in their practice. So I think that these are some of the treasures, I would say, that we can get out of the crisis.
Taught many people in the health workforce in France how important digital tools actually are, and that you're trying to retain what has achieved in this. Thank you so much, Isabel. We get back later to you and also asking you maybe a little bit about France and the French Council presidency, because this is one way, you know, to influence upskilling in the health workforce.
Sure.
Now, thank you so much. And let me turn to our next panelist, Nicholas Eckler from the Swedish Board of Health and Welfare. And we all know that Sweden is very advanced in many ways and has a great health system. And of course, digitally, it's also probably pretty much advanced. But how did you actually encounter COVID-19 and health system responses with regards to the health workforce and the digital skills? Nicholas, please fill us in.
Thank you, Matthias, and thank you for having me here. If you focus on the COVID pandemic, we've seen a lot of even further acceleration in the eHealth sector here in Sweden. We have been a very digitized country for 20 years or so, and almost all our electronic health almost all documentations in the healthcare is done by electronic health records. But we have seen that the Swedish caregivers are offering services in new ways. And one example is that on primary care level, before the COVID pandemic, it was 37% who offered digital consulting with patients, and now we're up to 82%. So it has really accelerated during COVID. But another thing that we have seen is that a lot of the services being offered has been developed on local or regional level. I was thinking about what Sarah said earlier, because Sweden is divided into 21 regions and 290 municipalities who are responsible for the healthcare. So it's a kind of a decentralized big system. And there's no turning back from this, of course, but now that society is demanding a more robust digital ecosystem, especially in the healthcare sector, the challenge for us as a national agency is to build a kind of robust healthcare and welfare system on a national level, so that we can lift all these regional and local solutions to a national level. So that is something that we've seen during the COVID pandemic, that it's a lot of good things happening, but a lot of more things should be happening on the national level.
So it's thank you so much for this, Niklas. And I think that is a very important message that even a country which is quite advanced with its digitalization and with the skills in the health workforce need to see that there's some commonality, some interfaces, and that this is really nationwide and not just regional solutions. Thank you so much. Now I would like to talk to the next panelist, Dirk from the European Commission, DG Santé. Dirk, you've heard all this. What do you think? What do you make out of it? Where's the European Commission in COVID-19 and the responses?
Good morning to all. Good morning, Matthias. I think if you ask what are the big picture observations across the health systems at EU level, I can only echo what most of the speakers said. One, the crucial value of information, and that certainly is for governing your public health reaction, so at a more central level, but also the way that the pandemic acted as a catalyst, and it changed the way in which health systems deliver services. We saw a huge uptake increase in telemedicine, and absolutely, if there is a silver lining to this cloud, this is one of them. And going forward, we need to understand how we can maintain the momentum. And certainly that also includes the upskilling and further equipping the workforce with the necessary skills. So that is one big lesson, the way we deliver services and what it also means for optimally using it in the future. Second big lesson is we already knew, of course, and any crisis will only confirm weaknesses we already know about, exacerbate structural weaknesses. One of those clearly was workforce shortages. And here, of course, going forward in the future, digital skills, digital tools, they also come into play. We should hope that all these nice digital eHealth solutions, they help to alleviate some of the pressure on the workforce, because we know that the demand for the workforce is only set to increase. And we know we already had pre-existing shortages only confirmed through the pandemic. So hoping that if we have the tools and we have the proper skill set and upskilling, that this will help alleviate the burden. I think those are the two main lessons that we saw with regard to the digital skills in the health workforce. Thank you.
Dirk, I saw the, thank you so much, Dirk. I saw the other panelists nodding while you were speaking, and very clearly, you know, we have issues with recruiting and retaining health workers in the system, and the pool in most of the countries is actually shrinking. So we need to be more efficient. And of course, digital tools hold the promise of more efficiency. And that actually takes us to our second round of discussion, the digital euro. What are actually the prospects? You know, what are the promises of digital euros? Is it just a nice to have add on, or would you say this is actually almost like a healthcare reset if we have digital and if we have a health workforce that is really adequately skilled to use these digital tools, but also patients with a health literacy that can also use the digital tools? If this all comes together, it makes a complete difference. You know, it's like a healthcare reset, or is it just a small add-on, a gradual improvement? Bernadette, I think you can give us a couple of insights from Germany about the importance and the magnitude of the change which might come with upskilled health workforce and digital tools.
Yeah. I would hope that it really becomes a really health reset. This is what we would like to see. And I think in particularly really to go for health and to go for even more health than other purposes in healthcare there might be. And I think the digital applications, they give us the big potential of really changing in this direction. I mean, if we really do it right and we have the data models set and up and running, we really could have a healthcare and have more outcomes oriented. We could see what we are really doing rather than doing really cumbersome studies as of now. But we could see it in one, just by putting a button to it. And this would make sense also for the workforce, what Dirk was saying. If we really could prove, for example, what the benefit of nursing work, that will help us a lot, because at the moment, the people, they don't see really the benefit of it, and they don't see what they miss from really good professional nursing work. And this would be my hope, really, to get a good push of it. And of course, what also the other panelists said, that it would help to alleviate the workload. That would be, of course, a nice thing as well.
So Bernadette, if I understand you correctly, you're saying that if the health workforce was skilled to use and allowed to use digital tools, that would put us on another level on health systems performance assessment, knowing how good the system is. But very important for the health workers, they could review actually their contribution and the performance of the system and could discuss how to increase the performance. So they had a very objective feedback actually, and that would also certainly contribute to quality and performance improvement. Thank you so much, Bernadette. I think that's a very, very important point. Now, let's get to Isabelle from the French perspective on the potential of upskilling the health workforce.
Well, this is indeed a real challenge, I have to say, frankly, and I really follow the steps of Bernadette in this. This is a huge challenge. I said earlier that with what we have experienced during the crisis, we have put in place a national plan for improving the acceleration of digital health in France. With a strong ambition, it's a 650 million plan, in addition to the recovery and resilience plan, which devotes 2 billion to digital health already. But part of this acceleration plan of digital health, we have 81 million, which are devoted to upskilling of the digital health workforce. This is a plan until 2025. And we take out two things, basically. First, the initial training of health professionals. And secondly, and I think it's very important, the continuous training over the career. And those two things are hand in hand and should help. And at the same time, at European level, this is also something which is very important, and I'm sure we'll come back to that. And I've seen some comments already in the chat about perception and so forth. I think that we need also to work on the perception of digital health, both on the citizen and digital health professionals. And that's one of the main reasons why we have been pushing forward, and that ethical principles for digital health have been adopted in the context of the French presidency of the EU.
Thank you so much, Isabelle. So both nationally in France, but also with the presidency, you say that France has understood the need not only to invest into the tools, but also in the health workforce, either in curricula or continuous professional development, and to upskill the health workforce. That is a key effort here. Niklas, can I ask you, I mean, you heard your colleagues, and some countries are more struggling than Sweden. Is there still potential to gain more performance from further digitalization, from making it better? Is there still a lot of potential, or are you already kind of at the ceiling of what can be achieved with upskilling the health workforce using digital tools?
Absolutely, thank you. I can just add on to the other speakers that this is a kind of a big issue to how to scale up both services but also skill. And we are working very closely with our Nordic neighboring countries on this, because we have a few cross-border eHealth solutions, since it's already the case that our citizens are working in one country but living in another, and also demanding healthcare in one of the Nordic countries but living in another, and so on. So we already have this situation going on, and I think that's something that we can say are that we're quite pilot rich, but we're proof poor. We can see that there's a challenge in converting pilots into day-to-day management, and if the uptake of pilots is too low, that means that the pilot itself, as well as the quality and so on, and efficiency, it's all lost, because it was only applicable when you did your pilot project, but you didn't put it to work in terms of skills and so on. So I think that we together need to figure out a way to overcome the challenge at the national level as well as at EU level, and also that aiming the efforts at digital skills is not only a way to make use of these digital services, but it's also a way to make the healthcare system more robust. We don't only need the same services, we also need, in a way, the same skills.
Yeah.
So,
Niklas, you were just mentioning the Nordic countries, and we all know that you have very close social, political, cultural relationships, and also cross-border healthcare is in some cases quite important. Is the digital skills set of the health workforce in Sweden already good enough to have cross-border digital tools?
in some cases, I would say yes, but that is mostly connected to that we share the same e-services. So we have national services for electronic prescriptions, and we have some pilots going on with healthcare, primary care in our rural areas. But I think that skill is something bigger. It's the ability to be able to use all these services to provide healthcare for your citizens. So because I think that there's a lot to do there.
I'm asking because we hear from many examples and from research that in cross-border healthcare, the patient record is actually not traveling, and that even sometimes the electronic prescription is not accepted because people don't know how to deal with it. So very interesting. Thank you so much, Niklas. Now, talking about Europe and cross-border collaboration, Dirk, I turn to you, please.
Yes, thank you, Matthias. I sympathize with some of the observations I heard, including on the scalability of pilots as they go through the valley of death, and absolutely the presence of the necessary skills is one of the crucial scalability criteria. So we have to bear this in mind. At the same time, you started, Matthias, by pointing to the digitalization, the digital upskilling in relation to universal healthcare coverage. And I also heard some of the speakers refer to, for instance, the European data space proposal, which is about patient rights. And I noted a comment in the chat box on not compounding existing divides. So there clearly, it's also one of the factors to take into account. Apart from the necessary digital skills, we also need to think about the digital divide on the patient side. Also in terms of political viability and uptake with the wider population, obviously. If I, for instance, looked recently at the latest Eurostat data, I noted that the difference in the income groups between the lowest and the highest in access to internet is still 20 percentage points. That's a difference between almost 100% access and less than 80%. So that's also part of the challenge we have. Upskilling, because clearly it is a crucial scalability factor from all the technical solutions we know that can work. But also, of course, do not compound existing divides and disparities, as I noted in the chat box. Thank you.
Thank you so much, Dirk. And I think actually Bernadette, she was talking about the patient in the center, and around this patient, it's not just professionals, there are also family and informal carers who are actually delivering the most part of care. And if they are not skilled to use these tools, if they are available, then of course we have also a problem. Thank you so much. And this takes us now to the third round, where we want to talk about the strategies as concrete as possible, how we manage the upskilling of the health workforce, how we manage to bring more digital skills into the system and to the health workers. And this time we would like to turn around a little bit the sequence. And I would like to start with Dirk, because I know that there are a couple of initiatives coming from the European Commission, actually, which are very important and need to be kind of discussed and adopted. And Dirk, please fill us in a little bit.
Thank you, Matthias. Indeed, just to give you an overview, and also I will try to explain you how these things fit together, because there are a couple of initiatives that are part of a comprehensive approach. One, the Pact for Skills, announced in 2020, meant to stimulate grassroots, bottom-up development, uptake of skills by the sectors. And of course, health and care in the broadest sense is also one of those sectors that are in the picture. So last year in 21, we had a roundtable with 3 commissioners, Schmidt, Breton, Kyriakides, discussing also in particular the digital skills in the health and care sector. And related to this, there was a launch of a call, Erasmus Plus call, for a blueprint for a digital skills strategy in the health and care sector. And there the purpose is indeed that the sector, bottom up, grassroots, comes up with a strategy. What are the priorities? What are the weaknesses? And how can we take this forward in terms of upskilling digital skills, the workforce? And I'm glad to announce that we had this call, this Erasmus Plus call out, and yesterday we selected the candidate, the European Health Management Association. So looking forward to bringing this further and having this see move and evolve. Also, a reference was made to the exchange of best practices, continuous professional development, and there was a reference to the EU4Health program. Now, under the EU4Health program, currently we have a call out, and we hope to close it in May on training. And the training, actually, the idea, it builds on the positive and successful experience using the emergency support instrument, where the intensive care specialists in Europe sat together and indeed had this exchange of best practices, because as we all recall, at one point the situation was very strained in the ICU units across Europe. Building on this positive experience, we have a call out for training, continuous professional development, aiming to cover the GP, specialist nurses, also the non-medical staff that is still in the healthcare sector, of course, also a crucial role to play. And definitely the digital skills are part of this upskilling and training. Yes.
Thank you so much. That is very encouraging that there's a lot ongoing on the European level. And I think we will pick this up and discuss this, because there's also an issue with regards to cross-border healthcare and having some sort of common framework for health professionals across Europe. Isabel, can I turn to you? You coming from the ministry and holding the presidency, strategies, being very concrete, implementing it.
Well, and we need concrete facts, in fact, and thank you, Dirk, for paving the way for that. Well, indeed, this is, as I said, a very key element that we want to address, and that we have been starting to address with the European Ethical Principle for Digital Health. We face scarce resources, scarce skills, and also another level of complexity, which is the multidisciplinary approach, which is required by digital skills in healthcare. So we are also in a new context. The new context is the new regulation coming for digital health in Europe with the European Health Data Space. And that means it will have a new digital health governance. So part of that governance, the topic of digital skills must be included, because we need, due to the scarce resources, scarce skills, and multidisciplinary approach, we need to cross-fertilize or approaches and share best practices at European level. A key element, for instance, we've been working very hard in France to have a referential of digital skills for healthcare. And this is something, that we could share at European level and use at European level. This is just an example.
Isabel, thank you so much. I think you touched a very important issue, the governance, but it's also a sensitive issue. I think Niklas made clear that regional solutions alone or pilots are not good enough. You need to get to the next level. And what you are actually saying is we need to include the European level. But of course, there will be sensitivities and issues, to what extent will European regulation then inform national curricula or national systems of continuous professional development. Niklas, what's your view on the implementation? How would you like to take this forward in Sweden, but also with a view to Europe, if you like?
Well, we have here in Sweden a national eHealth strategy called Vision eHealth 2025. And as a national agency, I think that we have an important role to play here. And one aspect in this is national guidelines in this area, since there are a lot of professions and a lot of people who are going to work with this. And the key is that these guidelines has to be in the form of concrete tools, I think. And one example that we have developed in Sweden, since we have been digitized for so long in the healthcare sector is a framework for our laws and regulations. We have over 75 laws and regulations addressing the digital healthcare area. So it's a kind of a big area for us. And that is a good thing, but it has also created a situation where it can be almost overwhelming for the healthcare professionals and caregivers offering these kinds of services. And one example of guidelines then is that we from the National Board of Health and Welfare here in Sweden has developed a national information structure, which is a regulatory framework showing how to apply and comply with these laws and regulations when you are developing digital services. So I think that there's a lot to do, and it actually would be super interesting to scale it up to an EU level. Thank you.
Niklas, thank you so much for mentioning the guidelines. And indeed, this is a very important element. And I have to apologize. Each of you can only touch upon one issue because we don't have enough time, but it's very clear. From Dirk, we need the policies, and the European perspective. From Isabel, we need to change the governance a bit. From you, guidelines will be an element. Bernadette, what's your take on it?
Yes, I wanted to highlight the directives that we have on the European level for the education of the health workforce. Particularly, we have those directives for nursing. So there's a common ground on how to educate nurses in Europe, and I think we could make use of it. That Europe puts a little bit in and gives more directive on how much digital content comes into the basic education of nurses, for example. This would work, I believe. And of course, I saw this in the chat. Edith was mentioning that a usual nurse would need less digital skills than a nursing developing into her career. And I think that's for sure. And of course, this is always a journey from everybody of us, that you have to, how you develop that, you have to develop your skills as well. But I think the basic point can really be well framed from the directives of the EU.
Yeah, thank you, Bernadette. You are actually making reference to this very important directive on the recognition of professional qualification, where the 5 regulated professions like doctors, nurses, midwives, pharmacists, and are included. And actually, there's quite some specification for nurses, more than for doctors actually in it. And you would argue, let's include something on the digitalization here. Thank you so much. I think that has been 3 really great rounds of discussion, and I see that there's quite some activity ongoing in the chat box. Dolly, would you be so kind and fill us in what you see in the chat box, and we feed it then together back to the panelists?
Hello, everyone. Thanks very much. And yes, indeed, a very rich discussion, both by our speakers. Thanks very much to all of you, but also in the chat. And partly resonating what you have been discussing here on the panel. On the one hand, the necessity of these, of providing innovative tools and regulations on the one hand, and the importance of that, but not to forget who are the implementers, not to take a short-sighted approach that in the end this needs to be implemented. So the focus needs to be on the health workforce, but also not to forget not only the health workforce needs to be skilled, but there needs to be an added value for the patients in the end. So we cannot forget who this is for in the end. Also, there were some comments on the, and I think also Dirk, you mentioned that, on the digital gap, the skills gap, also looking at the equality issues, both on the health workforce side, but also on the patient side. But everybody seems to agree that we have a window of opportunity now. And Bernadette, you were saying, you were even calling for a health reset. And there was quite some resonance on that in the chat. One thing that came up also in the chat, and there was a specific question on that, is the generational gap. So as Sarah mentioned, on the one hand, you have the digital natives who probably don't have a big hurdle to work with these tools. But let's not forget a quite big portion of the health workforce that is used to working with more traditional tools, and how to bring them on board. All this takes investment, one of the participants said, and investment both into research, but also into implementation, again, considering patients and the workforce. So one specific question was this on the generational gap. Bernadette, you were asked specifically how to involve nurses in the digital process, and I think you've already touched upon that in your comments, but maybe you want to elaborate a bit more. And another question was on how to combine the existing systems with this vision of digitalized systems. So how to combine the old and the new and to ensure interoperability. And research was another agenda. Matthias, I'll be done in a second. And research on the acceptance and the perception of digital tools by the health workforce. So to also look at the cultural and very practical elements.
Well, that was quite rich, Dolly. Thank you so much for synthesizing all these many comments and questions. And I jotted down, how to demonstrate that additional skills will add value for patient, the quality issue. There is a window of opportunity right now. We still have the generational gap, actually. Investment is needed. And how do we actually combine old and new systems so that they work quite perfectly? Quite a lot. Please only touch upon the issues where you feel best suited to answer. Don't try to answer all of them. We only have a couple of minutes left. Bernadette, maybe you want to start?
Yes, I just would focus on the question how to involve nurses. As I mentioned, I think the most important thing is to give them in Germany and hopefully across all the European Union access to electronic healthcare records so that we can really work as a healthcare team around our patients and persons. This is one point, and also to give an active role as digital health literacy also to provide from nurses. This is important to help our patients deal with the systems, and also, of course, to learn step by step the usability of applications. And I think I can't work them out. There are a lot of them to be used in a digital healthcare world.
Thank you so much, Bernadette. Next one, Niklas.
Thank you. I would like to address the question about combining old and new, because I think that a very important thing for us is to put ourselves in the patient's perspective and think about what kind of healthcare we want to offer and what kind of skills that would require. And I think it's something that you have to think about every single day when you work at the national level or policy level, that you have to aim to make more use of the technology that is, but also focus on the patient.
Thank you so much, Isabel.
Well, I'd like to comment on the last comments I've seen in the chat regarding the potential limitation of data protection. I think it provides also the right framework that we as European is part of our DNA and I think our humanistic values. And by the way, other regions are now trying to put in place also data protection regulation, and I think it helps innovation to foster digital health in the way we work.
Thank you so much, Isabel. Dirk.
So thank you, Matthias. I would start by repeating the actions that we have in place. So we have the blueprint for the strategy, which addresses bottom-up grassroots, the sector. The training call we have, which addresses grassroots, bottom-up, the professions. And then, of course, there was the question on the investments, which was also about the hardware and the software. There, of course, we have the recovery and resilience facility for the member states that already presented their plans for investments and reforms. We see that in all 37 billion will go to the healthcare sector, out of which 12 billion to digitalization of the health services, health systems. And linked to this, and this is the missing component, is the work by the colleagues at DG Reform in the Commission. It's all the technical support instruments we're rolling out, so that next to the brick and mortar investment, there is a strategy behind it that also takes into account what they called the flagship on digital skills for workforce, so that this is not left out when member states get technical support for drawing up roadmaps and strategic plans, going ahead, making the best use of all the brick and mortar investment. Thank you.
Dirk, thank you so much. And Dolly, I'm wondering, did we do something wrong today? I think there was almost no dissent between the panelists. You know, when we were talking about the state of play, they all agreed that COVID-19 has showed us a lot of deficiencies in our setup of digital skills. But also they were very positive that we have learned a lot and that there is hope that we retain some of this and make more progress afterwards. And they all agreed that, talking about Digital Europe, that investing more in the skills of the health workforce is not just a nice to have add-on, but it's a different dimension, actually, a different magnitude that would really boost health systems. And we were talking about the healthcare reset, you know, making integrated care true care. And I think they actually all agreed. And then what I found a little bit scary actually was that everybody agreed that the European Union should have really a role in this, you know, because sometimes when you ask governments and healthcare stakeholders, they would argue, ooh, this is already a highly regulated area and very complicated, and we don't want an additional player in this. We can do this ourselves. Like regions think they can do it themselves, like municipalities think they can do it themselves. So, Dolly, what do you think?
I don't think I can add much to that anymore. I fully agree. And I think we already said in the forefront of our discussions here that a crisis definitely does one thing. It uproots problems that were always there, and they were more undercover and less urgent than they became during the crisis. And I think that's what we've seen. And this window of opportunity, I think this is absolutely there. Just from the European Health Forum Gastein side, our conference this year focuses on the European Health Union, on a true European Health Union. So to really move this forward. Yeah, so from my side, big thanks to all the speakers. Great discussion.
Thank you so much. Thank you so much, Dolly. Thank you so much, colleagues. I can promise that we will follow up on this topic, on this large project which has been granted yesterday on the digital and green skills blueprint. So I think this is something which we will follow up with webinars here. And we should also mention that there will be a third installment, a third webinar on the European reference networks.
Yeah.
Exactly, and we are looking forward to this as well, because we think here is also demonstrable European added value to this. Thank you so much. Goodbye and have a nice day. Bye-bye.
Thanks, everyone.